Alliance has the great benefit of being able to draw on a long history of commitment to and involvement in quality improvement and performance measurement. In 1999, it was my pleasure to work with our former president, Alliance president, and good friend, Linda Juszczyk, in developing the first CQI tool, Continuous Quality Improvement Tool, for school-based health centers. Linda was really the architect, and it was wonderful that the Alliance became the repository for the tool as it morphed and changed over the next 15 years. So the Alliance comes to this job, and its members benefit from a long history in thinking about how we can secure quality in all the different aspects of school-based health centers that its many sponsors and supporters hope to see achieved. I believe there is broad support for using performance measures for school-based health centers, not only to improve outcomes, but as a mechanism to build consensus on health center priorities. It is essential to do it because partners in school-based health centers, the institutional sponsoring partners, need to have their needs met. It is why they will support the centers. It is why they will find money for the centers.
We are really excited about the collection of performance measures for school-based health centers for two primary reasons. One, credibility. We know that school-based health centers deliver incredibly high-quality healthcare to a population that's difficult to reach, adolescents, and being able to document through data the quality care that they're delivering to this population will be incredible to get them recognized as a critical part of a community's healthcare system. And secondly, it's really important for sustainability. We know that we're changing the way we pay for healthcare, one that was focused on volume to one that's going to be focused on value. And showing health outcomes through data is a great way to make sure that school-based health centers can get reimbursed for the quality care they're delivering and increase their financial sustainability so they remain a critical and sustainable part of a community's healthcare system. So we're really excited about this and can't wait to see what comes out of it.
We've been very fortunate here to have a robust, strong, fantastic school-based health center system, and a big reason of that is that we've got excellent data. We've got common data across our 6 different sponsor agencies that allow us to drive towards quality, to improve our reproductive health care, to improve our mental health services, and a variety of preventative services across the system. Not only that, we've been working with academic data for a long time, and that has been really key for us to secure and maintain the local dollars that support our school-based health center system. Using data strategically towards quality and sustainability is the opportunity in front of the whole field right now. We've got thousands of school-based health centers across the country, and if you've seen one data set from my school-based health center, you've seen one data set. This is the opportunity to provide coherence and to tell our story. Data creates the narrative that is behind school-based health, all the great, important work that people do every day to help kids be healthy, successful, and ready to learn. It's important that school-based health centers have data so we can tell a story. It's the backbone to the narrative that is school-based health. We've got so many great examples of kids, families, schools, faculty that we've helped. Data helps us get underneath that and create a story that's not just about one site or one city or one system or one state, but that it's about across the whole nation. It tells a bigger story. And not only is it a bigger story, but it's the story people want to hear. We are being asked again and again to provide data to support what makes sense in terms of bringing health care to kids in schools where it's accessible. but the data really backs it up, and it gives people what we are being asked to deliver. Thanks for listening to me. Hi, School-Based Health friends.
On the topic of data related to delivering healthcare, I think gone are the days when we're simply measured by seeing one patient at a time. I think many of us have had this discussion. I don't think it's unique to school-based health centers. I think it's true of medicine across the continuum. Certainly in pediatrics, we've been talking about this for a number of years. But I think the future of school-based health centers is the same as the future of healthcare, which is we are going to be measured by outcomes. We are going to be measured by the collective well-being of our population that we take care of. It may be in the not so distant future that we're not even simply measured by what we consider to be traditional health measures, that we might be measured by larger outcomes in terms of how our children are doing as successful members of society, what it means to be a student, what it means to be prepared for higher education, what it means to be prepared for the workforce. Certainly much is being written in the arena of social determinants of health. I think that's probably the biggest area that pediatrics and in particular school-based health centers are well positioned to impact. Collecting information about things that impact health and well-being of children and families that we don't currently do a very good job on. Things like access to housing, things like access to food, healthy food specifically, a place to exercise. These are all things that across the population are much more important than whether or not a child has a cold on a given day, for example. Those are things that we have got to be more sophisticated about in terms of knowing about, impacting, and delivering on in order to be successful in the future.
I just want to talk about the importance of data in school-based health centers and how it's helped us to inform policymaking and just good decision-making for the program. So the kinds of data that we've used to help inform our program is looking at how students are actually receiving services. So not only the types of services that they're receiving, but the frequency and also the quality or the quantity of those services. So data has helped to inform the decisions we make around funding, the types of services that we actually include. And a great example is a recent review of our data around our health questionnaire revealed to us that there was a number of youth that had substance use disorders, and the frequency was much higher than we thought. But by using that data and looking at our data, we were able to see what we needed to do. It's informing a new policy and a new practice and some clinical protocols about how to serve students with substance use.
We had a request a few years ago from a legislator that wanted to know what's the story about school-based health centers and Native American students. So we were able to dig into the data and disaggregate it and pull out and look at the patterns of usage and look at just Native Americans in school-based health centers. And what we found was that the rate of EPSDTs for Native American students was much higher, almost double what it was for other students. So because we had this granular level, simple data, we were able to look at it in lots of different ways we didn't even know we were going to have to. And we were able to learn a lot about school-based health centers. And in this case, that for Native American students, school-based health centers are a crucial, even more crucial access point for a very important well child exam service. So here's why I say that collecting performance measures, which I think we have to do with the state of technology, the state of where we're at, I understand that, but I hope that it's just a start, because I think the technology will support the ability to collect this granular level detail, to collect the data and calculate the measures. Because right now we're in a situation where the stakes are pretty high. We have to figure out exactly what performance measures we want to collect, and it's going to be hard to deconstruct that. So if we want percentage of EPSDTs, that's one measure. And if we decide, well, we want that by gender, now that's two measures. And if we decide we want that by ethnicity, and by semester, you can sort of see how that explodes. So I think that the technology is going to actually make it simpler to collect the simple granular data, and it'll give us much more power to calculate the the performance measures, what we think they are now, what we'll discover they need to be in the future. And so I think, again, this is a first step towards the road of big data for school-based health centers, and using that big data to make the case, to learn about them, and to promote school-based health centers in the bigger system of healthcare.
I have been data challenged. I love doing my work, but have not been deep into the nuts and bolts of creating reports, UDS measures, performance measures, until a recent 4-year SCHIP grant in Colorado and New Mexico, where I have become, I am now a data queen. I love data. It drives everything we do. It makes the decisions on where we go next clear. It helps us do the right work at the right time for kids. And I am a firm believer in using data to drive the school-based health center performance measures.
Since opening our doors in October of 2007, data collection has been the hallmark of our everyday practices. We firmly believe that meaningful data collection allows us to make informed decisions that in turn improve the quality of care that we provide for our student patients. Looking at the data also allows us to see what is working, and on the flip side, what needs to be improved. We are supportive of having a standardized national data set because the aggregation of data will give us the opportunity to see the bigger picture, and it will show us how we stack up to other school-based health center programs across the nation on a macro level. Not only would a standardized national data set give us clinical markers, but it would also lay down a beautiful landscape to pursue additional financial avenues. With increasing technology and electronic systems, our country is on the bus that is heading towards evidence-based healthcare delivery, and the St. Francis School-Based Health Center at Carroll wants a front row ticket to data land. We hope that you join us.